Hi, I'm Dr. Christina Han, Dermatologist and Medical Director at XYON Health. Today's topic is on pregnancy and hair loss, and specifically looking at postpartum hair loss or post-pregnancy hair loss. This is something that many women struggle with and is added to the stress of new motherhood. So let's dive into the information on this type of hair loss for this pivotal stage in your life. What is post-pregnancy hair loss? First, let's define what this condition means. Postpartum or post-pregnancy hair loss occurs after pregnancy and is a common occurrence amongst mothers. The first thing to note is that this is often delayed and occurs somewhere between 2 to 4 months after delivery of baby and can actually last up to 6 months. This term is also coined telogen effluvium or stress-related hair loss, and also comes in the literature as telogen gravidarum. This is related to the telogen or resting hairs falling out, and gravidarum is the Latin term for pregnancy. It's estimated that about 1/2 of women will experience postpartum hair loss. In this type of hair loss, the thinning is diffuse over the entire scalp, but most women will notice it mostly in the frontal hairline. Some women will even experience some burning or tingling with their hair loss. But the good news is, unless there's other sources of hair loss, that this is all temporary and reversible. Is it normal to lose hair during pregnancy? The reality is that most women will notice the hair loss in the postpartum or post-pregnancy phases, likely within 3 to 6 months after delivery. During pregnancy, most women will actually notice thicker and fuller hair growth with a slowing down of shedding. What are the causes of hair loss during and after pregnancy? During pregnancy, there are high hormonal changes that happen, particularly with estrogen and progesterone, which are needed to sustain a pregnancy. These hormones are likely to be beneficial for the hair growth cycle by prolonging the anagen or growth phase and allowing for more time of that hair follicle to be spent growing rather than shedding and falling out. Shortly after delivery, however, estrogen and progesterone levels fall dramatically with the delivery of the baby and placenta. As a result, these hormones likely contribute to the hair falling out, as well as an increase in the hormone that our body produces called prolactin, which is necessary for lactation or breastfeeding. Prolactin can actually inhibit the hair follicle by stunting the growth of that hair follicle into thick terminal hairs. As a result, what patients notice is a dramatic loss of hair very suddenly, with lots of clumps of hair falling out within that 3 to 6 month period after delivery. What are the best products to use after hair loss with pregnancy? First of all, I offer a lot of reassurance to my patients, as this is a temporary and reversible type of hair loss commonly seen in the postpartum period. Simply letting this hair loss run its course is often all that is needed. Like other types of telogen effluvium, once the stressor is removed, the hair follicles do reset and regrow back. And while there may be specific shampoos, conditioners, and styling products out there for this type of hair loss, the best practice is really to maintain a healthy, balanced lifestyle. This includes a proper balanced diet, good sleep hygiene, if that's even possible during the newborn period, as well as reducing stress as much as possible. There are, however, rare cases where some women can actually progress to unmask into a female pattern or genetic form of hair loss called androgenetic alopecia. This tends to happen in those that have an extensive family history of hair loss, and in this case, the hair loss is often not reversible and will be progressive over time. Fortunately, at XYON, we formulated topical agents to help tackle this type of hair loss. Specifically, Finasteride and Minoxidil, 2 proven agents in hair loss, are formulated into a gel that allows side effects to be reduced while not compromising efficacy. Hopefully you found today's topic on pregnancy and hair loss useful. This is something that is very common, but also probably one of the last things you want to think about during this milestone part of your life. That said, if your hair loss does not resolve, partner up with XYON to get your free consultation with a specialist physician to look at what treatment options are available for you. That's it for today. Thank you for watching this video. Hit like and subscribe, and see you at the next one.